Hello, and welcome. My name is Dr. Calliope. I'm going to be performing your eye examination today. How are you doing today? Okay. Well, I hope by the time you leave my office, you feel even just the littlest bit better. Let me just grab my clipboard and we'll get started with our examination, okay? Alright, so first I'd like to ask you some questions. First, would you mind just confirming your name for me? And your date of birth. Excellent. And is that your preferred name, and how do you like to be addressed? Wonderful. That's excellent. So, do you have any particular reason for this examination today? You think we have a changed prescription, or are you looking into getting glasses or contacts, anything of that sort? Oh, really? Okay, so we've got a case of anal glaucoma. Interesting. Would you mind just telling me a little bit about what you're experiencing there? Okay, so you just can't see your ass going into work. All right. Yeah, it's quite a common disease, I think, these days. And we can take a little look at that, okay? All right. Any other symptoms at all? Okay, I'd like to ask you some medical history questions, okay? Firstly, do you wear glasses or contacts at all? Even reading glasses? Okay, all right, that's fine. And any current pain or illness at all? Oh, okay, so you've had a pretty severe case of stigmatomycosis. Right, and that's rare blood disorder. Yeah. Okay, and any other changes to your medical history? Okay. Very good. And what about your family history? Does anyone in your family suffer with anal glaucoma or stigmatomycosis? Okay, so whole family anal glaucoma. Yeah, it sometimes can run in the family. It really depends. And any allergies at all? Okay, very good. And any medications? Okay, so you're on Adderall, and what is that used for? Oh, so you got diagnosed with cool guy syndrome. Okay, let me go ahead and just make a note in your medical history. Okay, cool guy syndrome, and now you take Adderall. Awesome. Okay, I think that's about all I need there. So we're going to go ahead and take a look, of course, at your eyes. First, I want to do a general inspection, a little bit of palpation around the eye itself, and then we're going to be doing quite a few different tests, okay? All right, so for this examination, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, excellent. So I'm going to pop on a pair of gloves real quick, just because I'm going to be getting so close to your eyes, all right? So I'll be just a moment while I get those on. Have you had that anal glaucoma for very long, do you think? Okay, so it's pretty much been a lifelong condition. Yeah, I hear that quite frequently, but we'll see what's going on. Right. Okay, and there we are. There's our gloves. So I'm going to be getting very close to you, okay? And I'm just going to be taking a look at the eyes. So have you had any changes in your vision at all? Any symptoms like dry eyes, itchy eyes, tired eyes, watery even? Okay. Do your eyes get affected by seasonal allergies at all? Okay. All right. Do you happen to spend a lot of time on devices like a computer, a laptop, a cell phone, watching TV, anything like that? Okay. And do you happen to use a blue light filter at all? Yeah, luckily there are a lot of devices that have blue light filters. On Windows, I know you can find it in settings under night light, and that really helps. I always keep a blue light filter on my phone and on my computer, and then I also wear blue light filtering glasses too. My eyes are super sensitive to blue light. So if you find that your eyes are getting really tired after watching screens for a while, that might be a good thing to try. So blue light's what keeps you up at night, really messes with your circadian rhythm. And just overall reducing time spent looking at screens would also help. But, you do what you can, right? Okay. So upon inspection, your eyebrows are intact, your eyelashes look nice and full, and the eye itself, there's no irritation. I'm not seeing any redness. I'd like to take a little look at the conjunctiva, if you won't mind. So I'm going to pull your eyelids down, and I'll have you look up, and I'll pull them up, and I'll have you look down, okay? All right, so I'm going to pull down. I want you to look up. Good. Okay. And I'm going to pull up. I want you to look down. Very good. Very good. All right. That looks great. You can go ahead and blink a couple times. I know that can be a touch uncomfortable. Yeah, so looks all pink throughout, which is good. Your sclera is very clear. Your irises and your pupils look nice and bright and healthy. So overall, I think you're looking pretty good so far. Okay? All right, so we are going to do some different eye tests. Now first we're going to test your visual acuity, in which I'm going to bring the Snellen chart out. And when I bring that out, you will probably recognize it immediately. And we're going to test that your visual acuity is good, that you have at least 20/20 vision, okay? Otherwise we'll talk about glasses or contacts, all right? So I'm going to just bring that out here. Now this office doesn't allow me to hang up anything, so we'll have to just make do with this little bit here. So I'm just going to grab my little pointer here, and we're going to do some tests, okay? So first I want you to cover your left eye, all right? Okay, just go ahead and cover your left eye, and using only your right, we're going to go through our Snellen chart, okay? If you could just read me the letter that I'm pointing to, that would be great. Good. 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 Just going to adjust. Good. 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 Yep. Good. 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 Yep. Good. Good. Let's go ahead and skip down here, okay? Yes. Yes. Good. 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 All right, let's do this last one, okay? Can you read this one? Good. 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 Yep. Very good. Okay. So if you want to go ahead and just uncover that eye, you can blink a couple of times if you need to. And we'll start again using this time your left eye, okay? So I want you to go ahead and cover that left eye. And we'll go ahead and start again, okay? Right here. Here. Good. Good. Yep. Good. Here. Good. 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 Yeah. Very good. 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 Yep. Very good. Let's go ahead and go right here. Yep. Good. 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 And let's go ahead and skip to right here, okay? Good. Good. Yep. Yep. Very good. And brilliant. Okay, so you could go ahead and uncover both of your eyes, take a few blinks if you need to, and then we'll do this one last time with both your eyes open, okay? All right, you ready? Good. Good. Yep. Good. 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 Oh. My apologies. Let's do that again. Yep. Good. Good. Yep. Good. 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 Okay. Good. 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 Yep. Good. Yes. Good. Very good. 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 Yep. Good. 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 Very good. Yep. Yep. Good. Good. Brilliant. Very good. And let's see if we can get these last two. Let me just stabilize this. There we go. Good. 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 Yep. Good. Let's do that last line there. Okay. Good. 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 Yep. And perfect. That's excellent. So that looked very good. I do appreciate the patience when it comes to the floating Snellen chart. There are certainly easier ways to do it, but alas, let me go ahead and just note that down. So your visual acuity is excellent. All right, very good. Okay, so let's go ahead and test your visual fields. So I'm going to have you cover one eye, and then I'm going to cover the same side of eye, and I'm going to be bringing my fingers in, and I just want you to tell me when you see them come into your vision, okay? So for example, if you go ahead and cover this eye, I'm going to cover this eye, okay? All right, so just go ahead and focus on my nose and let me know when you see my fingers come into view. Yep. Good. 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 Great. Let's go ahead and do that with the other side. So go ahead and flip so that this eye's covered, and I'll cover this one, okay? All right. Good. 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 Mm-hmm. Good. Very good. Okay, that looks great. Alrighty. You doing okay so far? Feeling alright? Okay, just want to make sure. Alrighty. So let's go ahead and do a little cover test. So for this test, you won't have to do absolutely anything except for stare ahead. What I'm going to be doing is covering one eye, and the one that's not covered, I'm going to watch for a little bit so that I can see if there's any movement, if there's any defect in the way your eye operates when the other one is covered, okay? Alright, so I'm just going to go ahead and cover this eye. I'm just going to watch the other one. Just going to sit here for a moment and watch. Very good. And I'm going to do the other side here. So just covering the other side and looking at the eye that isn't covered and just making sure that it stays still and it doesn't do anything wonky. Okay, and 3, 2, 1. Okay, very good. So yeah, super simple, but a much needed test nevertheless. Alrighty, so now I want to check your periphery a little bit, in that we're going to do something that we call the finger wiggle test. So what I'm going to have you do is I want you to stare at my nose, and I'm going to have my fingers just to the sides here, and I want you to tell me when you see one of them wiggle. For example, this one wiggled, this one wiggled. So all you have to do, you don't have to tell me which side, just say yes when you see the finger wiggle, okay? Mm-hmm. Good. Mm-hmm. Yep. Mm-hmm. Good. Yep. Mm-hmm. Yep. Good. Mm-hmm. Good. Mm-hmm. Good. Good. Uh-huh. Mm-hmm. Good. Very good. That was excellent. So your periphery looks great. Alrighty, so it is time to bring out our pen light for a little bit. So with the pen light here, we're going to be doing a few different tests, okay? So firstly, we're going to do the direct consensual response test. This tends to be a favorite one among my patients. What we're going to be doing is I'm going to hold my hand up right in between your eyes so that they're shielded from the other. I'm going to bring my pen light in at a diagonal and shine it into one eye. When I shine this light into, for example, this eye, the pupil should react to the light. That would be our direct response, as your eye is directly responding to the light that's being shined into it, right? And on the other hand, when we do that test and when I shine this light into this eye, your other eye that doesn't have a light being shined into it should react in the same way at the same time as the other eye that is being shined into it. That would be our consensual response, okay? So all you have to do is look straight ahead, okay? I'm just going to put my hand up between your eyes, and I'm going to bring my light in, and I'm going to watch the direct, consensual, and consensual response. Very good. I do apologize about the shakiness. I have quite a noticeable tremor. Hope it didn't bother you too much. Let's go ahead and do that for the other side. Direct, 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 consensual, consensual, and consensual. Excellent. So easy enough. For this next test, this is called the swinging light test. And again, all you have to do is look straight ahead. I'm just going to be bringing the light to one eye and the other, and the other, and the other, back and forth to check for any defects in the way that your eye responds to the light, okay? So just go ahead and look straight ahead. I'm going to shine this light into one eye, and the other, and the other, and the other, and the other, and the other. Very good. Just shining back and forth, back and forth. Okay, I think that looks great. So I'm just going to take a couple notes real quick, and then we're going to move on into checking your ocular movements. Okay. So now we're going to do a fun little test called Follow the Light, another tried and true favorite. So I'm going to be having our light right here, and I want you to focus on the light using only your eyes without moving your head, okay? So we're going to be testing your eye movements. So you're just going to be following this light back and forth using only your eyes without moving your head, okay? So if you could just focus right here, okay? And we're just going to move the light around and just follow it as best as you can, okay? Just follow the light as best as you can. Follow the light as best as you can. All right, very good. Very good. You're doing really, really well. Very good. Okay. Let's go ahead and go up, down, to the side, to the other side. Okay. Up, down, to the side, to the side. Okay, let's go diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Very good. While I've got the light here, we're going to test your accommodation reflex. What this means is I'm going to have you follow this light again, but this time I'm going to move in and out with the light, and I want you to just focus on the light as best as you can, okay? So keep your eyes right here without moving your head. We're going to go in and out, and in and out, and in and out. Okay, I'm just going to switch sides here. Just keep following this light. We're going to go in and out, and in and out, and in and out. Very good. So we've got one last test before I bring out our ophthalmoscope, okay? So we're going to check your pursuits and your saccades. So your pursuits are smooth, slow eye movements. So I can kind of watch them when we're doing the follow the light test, but primarily I'm just checking for how your eye moves. And this I'm going to be really focusing on how your eye reacts to just tracking slow, smooth movement, okay? And then with your saccades, that's going to be your rapid eye movement. So I'm going to have you look from one point to another as fast as you can, okay? All right, so let's go ahead and check the pursuits first. I want you to follow this finger, okay, using your eyes without moving your head. We're just going to go real smooth, back and forth, real slow, real smooth. Just want to check those smooth, slow eye movements. Nice and easy, nice and slow. Very good. Okay, great. So now I have my two fingers up and I want you to look from the left to the right, back and forth as fast as you can, okay? So left, right, left, right, left, right, okay? All right, can you do that for me? Okay, look at the left, the right, left, right, left, right, left, right, left, right. Keep going. Very good, keep going. And you can go ahead and stop. Okay, so your pursuits and your saccades look great. And now we're going to bring out the ophthalmoscope and we're going to do a little fundoscopy. So this is our ophthalmoscope. The ophthalmoscope is a tool that allows me to see the back of your eye so I can check up on inside the eye, the optic nerve, all the little blood vessels in your eye. We can check on the health of that. And the way that I do that is I'll flip on our little light and just want to adjust real quick. Okay, very good. And then I'm going to be putting one hand on top of your head to steady myself. And with the other, I'm going to come in at an angle. And I'm going to come in pretty close and look around the eye, okay? I'm going to put my hand on top of your head here. I'm going to put my eye on the ophthalmoscope. I'm just going to look for the red light reflex, and that tells me that I'm in the optimal spot. Okay, and then I'm going to move in pretty close, and I'm just going to look at the back of your eye. Very good, very good, very good. So here I can easily see the optic nerve, the little tunnel that it creates, and I can see all the little blood vessels, and I'm just making sure the health of those is good. There isn't any abnormalities. Okay, I'm going to go ahead and pull back, and we're going to go ahead and do that on the other side. Put my hand on top of your head. I'm going to find that red light reflex, and then when I do, I'm just going to come in real close and just take a look at the back of your eye. It's really quite fascinating how this little tool allows me to look inside of your eye so that we can make sure that everything is normal, that everything is healthy. Okay. Alright, so that looks pretty good. I'm going to go ahead and back off there and turn off the light. So, real easy, real nice. Okay? Alright, let me go ahead and just make some notes there. that wraps up our eye examination. Now, I didn't find any particular physical reason why you would have this anal glaucoma problem here, but I do have a possible solution here, okay? So it tends to be pretty effective, but for some people, there's just no cure for it. But I'll go ahead and write you a prescription. So the best treatment for anal glaucoma, for not being able to see your ass going into work, is your rent being due. Right, yeah, first of the month. Sometimes people get a few days leeway, but your rent is due, okay? Yeah, I know. That can be a little difficult for some people, and it can be a bit of a change of lifestyle, but overall, I think that most people tend to take pretty well to that particular solution. Yeah, sometimes it takes a bit of time, but yeah, your rent's due. Right. So, do you have any other questions for me? Any other comments? Okay. All right, no other concerns. Okay. So yeah, with your visual acuity being so good, I don't think we'll have to talk about eyeglasses or contacts or anything, which is good. They're a little expensive, but technology is a beautiful thing, huh? Yeah, allows us to see even when we may not be able to see anything. So I am going to go ahead and sign off on your exam. Okay. And I think that about does it for us. Okay. So thank you so much for coming here today, for having this examination with me. I really hope that you enjoyed it. Okay. And I hope that you have a whale of a day, and good luck with that stigmatomycosis. I know that one can be a little tough to have sometimes. Yeah. So I will see you later, okay?